GPCOG stands for General Practitioner Assessment and Cognition and is a screening tool for cognitive impairment and dementia in a primary care setting. It is very similar to the mini mental state examination. The GPCOG takes approximately 4 minutes to complete the patient assessment section and another couple minutes to complete the patient informant interview. It is recommended that the GPCOG be used to screen for cognitive impairment and dementia at every annual Medicare wellness visit. The GPCOG is not influenced by culture or linguistic background, so it's a very valuable tool that can be used in a variety of multicultural settings. An indication to administer the GPCOG is for evaluating for cognitive impairment or dementia in a primary care setting. The test has a high sensitivity, but a few limitations. First, it's possible to get false negatives, although it is rare. The GPCOG is also not a diagnosis, it's a screening tool. If the GPCOG scoring suggests possible cognitive impairment, further testing and evaluation is indicated. The GPCOG is available in multiple languages. It requires that the patient be able to draw as well as hold a writing utensil in their hand in order to fully complete the examination. GPCOG has a maximum of 9 total possible points. I'm going to ask several questions with each correct answer worth 1 point. First is the name and address test. I will give the patient a name and an address. After it's said, I'm going to ask the patient to repeat this name and address to me. I'm also going to let them know that they are going to need to remember this because in a few minutes, I'm going to ask them to tell me the name and address again at a later time. They're going to have a maximum of 4 total attempts to do this the second time. Each part of the address is worth 1 point. So the first name, last name, number, street, and town for a total of 5 possible points. Second is time orientation. I'm going to ask what the date is today, and it must be exact. So that means day, month, year. This is worth 1 point. So next is the clock drawing. I'm going to have the patient draw a analog clock with the correct numbers and spacing. And then I'm also going to ask them to mark the hands of the clock at a certain time. So for example, I might ask them to draw the clock at 2:10. Next is information. I will ask the patient to tell me something that happened in the news recently this week. This also requires that they go into some detail. If they're able to be detailed and specific, they're going to get 1 point. Lastly is recall, so I'm going to ask the patient to repeat the name and address that I asked them to memorize earlier. If the patient scores a 9, there is no significant cognitive impairment and further testing is not indicated. If a patient scores 5 to 8, more information is required, and you should proceed to step 2 and do the informant interview. If a patient scores between 0 and 4, cognitive impairment is indicated and standard investigations are needed. So step 2 is the informant interview. A reliable source that knows the patient well, aka the informant, will need to be contacted, and they will need to answer 6 questions that compare how the patient is today to how they were approximately 5 to 10 years ago. There's a maximum of 6 points possible for the section, and it takes about 2 minutes to complete. It can be done in person or on the phone or maybe even on a Zoom video call. If a patient scores between 0 and 3 for this section, cognitive impairment is indicated and standard investigations should be conducted. Here is an example of how the GPCOG exam is performed. So I'm going to give you a name and an address to remember. I want you to repeat it back to me and then also remember it because I'm going to ask you it again in about 5 minutes.
Okay.
So the name is John Brown and the address is 42 West Street, Kensington.
John Brown, 42 West Street, Kensington.
Good. What is the date today?
Today is February 2nd, 1999.
Okay. Next, I want you to draw a clock on this whiteboard here.
Okay.
Make sure you write in all the numbers, and you don't have to draw the hands for me yet.
Okay. Let's see.
Okay.
Got it.
Now, can you please draw the time as 10 minutes past 11?
10 minutes past 11. That.
Okay. Now, what was that name and address I asked you to remember earlier?
The name and address was John Brown, and the address was 42 West Street, Kensington.
Perfect, thank you.
Hello,
Hi, is this Albert Medina?
this is.
Hi, my name is Natalie Milstead, and I am a PA student working with your brother, Edmundo. I am completing a cognitive impairment test on him, and I was wondering if I had your consent to participate and be his informant.
Of course.
So what it's going to consist of is me asking you about 6 questions. These are going to be, you're going to compare how Edmundo was about 5 to 10 years ago.
Okay.
So for question 1, does Edmundo have more trouble remembering things that have happened recently than he used to?
I think a little bit, yes.
Okay. Does he have more trouble recalling conversations a few days later?
I don't think so, no.
When speaking, does Edmundo have more difficulty in finding the right word or tend to use the wrong words more often?
It does take a little bit to respond, so I think sometimes yes.
Okay. And is Edmundo less able to manage money and financial affairs such as paying bills or budgeting?
To be honest, I'm not sure. We haven't really looked into his finances.
Okay. And is Edmundo less able to manage his medication independently?
I don't think so.
Okay. And does Edmundo need more assistance with transport, such as private transport or public transport, such as the bus?
No, he's still driving around, actually.
Okay. All right. Well, thank you so much for participating and helping us to do that assessment. I appreciate your time.
No problem. Thank you.
Bye. Here is Edmundo's GP-COG score for the first half of the patient examination portion. And here's the second half of his score for the patient examination portion. He scored 7 out of 9, which means that further evaluation and investigation is indicated, and we will move on to step 2. Step 2 was the patient informant interview, in which Edmundo scored 4 due to his brother's no and I don't know answers, which you will see his total score on the next page. This is not indicative of cognitive impairment, but if the score were 0 to 3, then it would require standard investigations to be conducted. All in all, the GP-COG is a very reliable tool in order to screen patients for possible cognitive impairment and dementia, and when indicated, is an important inclusion in a patient's healthcare exam.